Thank you, and welcome back to those who are watching us online on live stream on fijivillage. Thank you again as you partake in these discussions, the Talanoa session on responding to illicit drugs and substance use disorders in Fiji. And as we've said, that this Talanoa today will result in a counter-strategy action plan that has to start immediately with urgency based on the situation on the ground. We've talked about some statistics that have been available, of course, in the school system. The reported statistics giving us a picture of 3,500 cases in a year as far as drug cases are concerned, and that includes cases of methamphetamine, hard drugs like cocaine being found in the school system, and the issues that we need to look at, including other substance abuse like cigarettes, alcohol, grog, and marijuana. We'd like to thank our next set of panelists to discuss harm reduction and interventions. We have Dr. Rachel Devi from the Ministry of Health, and Dr. Rachel has done a lot of work in the area of also HIV/AIDS cases in the country. And as you know, there's shocking statistics that continue to be revealed in the last few years in terms of our numbers. In the Asia-Pacific region, we are one of the top countries as far as reported increased cases are concerned. And the increased usage of intravenous methods, which is using syringes and needles to inject drugs into the system. We have the country and regional director of UNAIDS, Renata Ram, who will be talking about this HIV/AIDS statistics and what we can do. And we have Three Angels Missionary College's Gabriel Simpson, who will be talking about the issues at hand and how he has some success stories as far as harm reduction is concerned. Dr. Balram Pandit from the St. Giles Hospital. Dr. Balram, thank you very much for joining us today. So we'll start off with Dr. Rachel on the issue of the status of substance use disorders in Fiji and the increasing cases of HIV/AIDS, mitigation measures, and the way forward. Thank you, Dr. Rachel.
Thank you, Vijay. It's a privilege. All protocols observed. Respected panelists and guests, invited guests, and even online viewers. It's honestly an honor to be in the panel with the team here, and the discussion in itself is grave. It's a matter of urgency in terms of response. Now, the question you asked in terms of statistics, now that goes far and wide. When we talk about injectable drug use in Fiji, well, and its relations to health, when you consider that, HIV has been one of those important rising factors and issues that's contributing to it. Now, if you look at stats alone, well, Fiji alone, in 2023 alone, had 415 new cases of HIV. I must say, we cannot 100% guarantee what percentage of that was due to injectable drug use, but you can even look at it, a good number that's coming out of it. While predominantly Fiji's statistics for HIV is sexual transmission, especially this year, we are noticing an increase in injectable drug use. I'm sorry, the exact data is something that I cannot release at the moment, but having said that, we can see almost 25% cases coming out of that space, especially even within one clinic, but that's still yet to be verified further. We do go through a verification process. But having said that, you must have heard recently in days and this is very unique to Fiji, something called Bluetoothing and chemsex. And Bluetoothing is absolutely super dangerous. And even chemsex, but Bluetoothing being literally you transmit blood from one person to another, where individuals get high from injectable drug use, whichever it may be. And they literally transmit that same, once they high on that, they literally withdraw blood and circulate it amongst a group of peers. And I believe Kalesi, I'm not sure if you mentioned in the last discussions, but she's shared this publicly where they've walked into streets where they've seen this come up and literally, seeing that themselves. And that's reality on the ground. And the use of needles has increased significantly from observations. But I believe Dr. Balram will also share a good number of statistics from what they see from admission cases, because from that we are 100% sure that that is drug related. But from the HIV context, we are seeing a good proportion coming up as we're progressing, especially with the recognition of drug and HIV relations. That's something that's predominantly coming, even with pregnant women, individuals who turn up and admitted in the wards. I mean, Dr. Mara just mentioned of a case, 11-year-old in Lautoka, and we seeing that a lot more. And people, I must say, I don't know, is it the sensitization that's going on that we talk about it a lot more, but people are quite keen and openly talk about it even with healthcare workers, which is a positive thing. They do tell us, I did inject drugs and I have shared needles, etc. So that is something that's coming up a lot more open and it's a lot more prominent. So Vijay, I think I'll leave the stats as far as that.
Thank you, Dr. Rachel. And just that statistic just coming off, and of course we'll be looking at the confirmed statistics as the numbers have said, injectable drugs at one of the labs showing about 25%. And that's concerning for HIV/AIDS for this year already. And that the alarm bell should be ringing that we seeing a high number of cases now coming through injectable drugs. You're watching on Fijivillage the Talanoa session on responding to illicit drugs and substance use disorders in Fiji. We're here at the Fiji National University Nasinu campus, and of course the first day of open Talanoa session, and all hands are on deck and should be on deck in relation to this issue, because we need to look at harm reduction. Next speaker